Here is the 360 of my room. There's where my phone will be set up. Here's my consent form. Jesse, do you consent to being in my video?
Yeah.
Okay. All right. So first, let me scoot this. First, I would start off by washing my hands, which I've already done, and then I would introduce myself to my patient. So I'm Cami. I'm going to be your nursing student today. Can I have your name and your date of birth, please?
Jesse Mitchell, 6/21/99.
Okay, in case of your wristband. So I would make sure to confirm the information he gave me with his medical ID wristband, which they did match up. And then I would make sure to provide privacy for him, and then go over the medical assessment or medical order, and then let him know what I'm doing today. So I'm going to be doing a head-to-toe assessment on you. So then I would just go in and make sure that I go over his medical history. Do you have any concerns that I should know about today?
I just had knee surgery 2 weeks ago.
Okay, so he did just have knee surgery 2 weeks ago. Do you have a history of diverticulitis?
No.
COPD?
No.
Okay, so the patient did have knee surgery, but he doesn't have any medical history that would affect my assessment today. So now that I have done that, I'm just going to do a quick mental assessment. So the patient does seem to be awake. Can you answer a few questions for me? What's your name?
Jesse Mitchell.
Where are we?
Home.
What time is it?
3:30.
And what are we doing today?
Head-to-toe assessment.
So the patient is alert and oriented ×4. He does, his speech is clear. It's not slurred at all. His appearance is clean. He's put together. His clothes are not dirty or holey in any way. He's dressed for the occasion. So all of that seems to be good. So now I am going to move on to his facial assessment. So I'm going to assess his facial features. So his eyes do seem to be symmetrical, as well as his nose is midline. And if I were to draw an imaginary line, his eyes would match up with the top of his ears. So can you go ahead and smile for me, frown, puff your cheeks, and then raise your eyebrows. So all of his facial features were also symmetrical with movement. So that is good. So now I'm just going to inspect his face. I don't see any color variations on there. His skin is a pale beige color. I don't see any lesions, just a few red spots. I do see one lesion on his nose right here in the form. It would be a primary lesion in the form of a freckle. So now I'm going to inspect his hair. Is it okay if I touch your hair?
Mm-hmm.
So I'm just checking to make sure it is all evenly distributed, which it is. I don't see any patchiness or baldness, and it is not dirty. It's dry, clean, no drainage on or lesions on the scalp. So now that I have done that, I am going to inspect your eyes. So first, can I have you pull down your eyelids for me, and then go ahead and just look around with your eyes. So his sclera, all of them are white. There's minimal red veining. I don't see any drainage coming from the eyes, so that is good. And then I am going to do the positions test. So I'm going to be testing the 3 cranial nerves, cranial 3, which is oculomotor, cranial 4, which is trochlear, and cranial 6, which is abducens. So I just need you to follow the tip of my pen light here. I'm going to do 6 different motions. So as I'm doing this, I am just checking to make sure his eyes are moving smoothly and clearly, which they were. There was no shakiness or nystagmus present. Now I'm going to assess Perla on him. So I'm going to inspect his pupils first and make sure they are equal, which they both seem to be about 4 millimeter. They are both round, and then I'm going to inspect and make sure they are reactive to light. So I just want you to look over my shoulder for me, and I'm going to do test for indirect light. So I'm just going to shine this into your light and see if they contract, which that one did. I'm going to do it the opposite side, and they both did contract. So now I'm going to do indirect light. I'm going to shine it into this eye and make sure that the opposite eye does contract, which it did. I will do it to the opposite side, and they did both contract. So they are both reactive to light. Now I'm going to check for accommodation. So can you again look at the tip of my pen light? Your eyes may cross, but that's okay. So I'm making sure that both of his eyes constrict and converge, which they did. So that is what we like to see. So the Perla checks off everything, met the standards. So now I'm going to inspect his mouth. I am inspecting the lips right now, and they are a light pink color. There's no cracking, they aren't dry. Do you still have your tonsils?
Mm-hmm.
Do you have dentures?
No.
Nope. So the patient still has his tonsils and he doesn't have dentures. So I'm going to go ahead and look inside his mouth and inspect some things in there. Can you go ahead and open your mouth for me? Okay, and then smile for me. All right. So there were no dental caries in his in his mouth. His teeth were white. There was no lesions or drainage on his cheeks. His throat was just a pink color, and his tonsils were not inflamed or anything. They weren't red, so those would be a grade 1. And his tongue was moist, pink, not cracking, no drainage, and I did not notice any odors coming from his mouth. So now I'm going to inspect your neck. First, I'm just going to visualize it. I'm just going to be checking for any masses or bumps, which I don't see. Is it okay if I palpate your neck? So his trachea is midline, and I do not feel any masses on his neck. So that is good. So now that I have done his neck assessment and everything above, I'm going to go ahead and do a general assessment. So he is sitting up straight. He is just using his diaphragm to breathe. He's not using any accessory muscles like the trapezius or intercostal muscles. He is breathing room air. He doesn't have any supplemental oxygen hooked up like a nasal cannula. So that is good. Okay, now I'm going to go ahead and listen to his lungs from the posterior side. Could you go ahead and turn around for me? So I'm just going to do 12 different positions each time. Before I do this, actually, I'm going to check your back. So the scapulas are flat. Can you sit straight up for me? Scapulas are flat. His spine is midline. And then go ahead and take a breath for me. Good. So his chest expansion was normal. My hands floated out and then floated back in. So now I'm going to go ahead and listen to his lungs. All right, go ahead and each time I place this on your back, take a deep breath for me. So his lung sounds were good. I didn't notice any crackles or wheezing. They were clear. So that is what we like to hear. I didn't notice any tension when he was breathing either. All right, you can go ahead and turn back around for me. I'm going to listen to the front side. And same thing, every time I put my stethoscope on, you go ahead and take a breath. I'm going to go ahead and start above the clavicle. Good. So all of his lung sounds on the front were also clear. I didn't notice any crackling or wheezing. All right, so now you can go ahead and lay on your back. I'm going to do an assessment of your abdomen. And then just go ahead and lay with your hands at your sides. I'm just going to drape this over you. All right. Sure you can see. So now I'm just going to assess his abdomen first and inspect all 4 quadrants. And I do not see any color variations. I do see a secondary lesion on the right side in the form of a tattoo, but I do not see any infection or drainage coming from that. And then on this side, I do see a scar from, it looks like a past procedure, which would be another secondary lesion. Looks intact. It is no drainage or infection there either. So all 4 quadrants are symmetrical. His contour is flat. I don't see any distension. His umbilicus is midline. No redness or drainage coming from that either. Now, I do not see any palpations when I check the stomach either, so that is good. So now I'm just going to auscultate. I'm going to start in the right lower quadrant. Are you having any pain in your stomach today?
No.
So the patient responds he's not having any pain in his stomach, so I will start in the right lower quadrant. If he was having pain, I would start in the quadrant where I would be able to end in the quadrant where his pain is present. So I'm just going to be listening for bowel sounds first. So I did hear about 10 to 12 bowel sounds when I was auscultating, which is in the active range, which is what we like to hear. Now I'm just going to palpate and inspect his stomach. So let me know if you have any pain or tenderness while I'm doing this. Any pain so far?
No.
Okay, no pain?
Nope.
Perfect. So the patient didn't have any pain in his abdomen, so that assessment is done. All right, so you can go ahead and sit back up. and then go ahead and turn around for me. Do you have any history of kidney problems?
No.
Okay, so now I'm just gonna perform the blunt percussion test to his kidneys. So let me know if you have any pain. No pain?
No.
No pain?
No.
Perfect. So that concludes the assessment. So then I would just close. I would position my patient for comfort, make sure the bed is at the lowest position, side rails up ×2, the call lights are in reach, and then I would go document any of the findings that I found during the assessment.